Good evening. We are back with yet another episode of BMC Global Live, AlHilal Health World, Nothing But Lifestyle. I am Jasila Mujib. Your health is our concern. So, in each episode of this talk show, we bring before you an expert doctor from AlHilal Hospital to discuss your various health issues. PCOS, that is polycystic ovary syndrome, is a hormonal imbalance that is found in women of reproductive age. This condition, if left untreated, may lead to serious complications like diabetes, hypertension, heart diseases, and may even lead to infertility in women. We are delighted to have with us Dr. Nisha Parameswaran Nair from AlHilal Hospital, Hith, to discuss this topic. She is a specialist in obstetrics and gynecology with an experience of over 15 years. So, let's welcome Doctor to the show and move on to the topic. So, Doctor, welcome to the show and thank you for being with us to discuss this topic, polycystic ovary syndrome. This is very relevant now and we hear many ladies complain about this condition.
Thank you, Jasila, for giving me this opportunity, and thank you BMC for giving this opportunity to give a small talk about polycystic ovarian syndrome.
Okay, Doctor, it's a pleasure for us.
Thank you.
So, Doctor, let's begin by discussing what is PCOS or polycystic ovary syndrome.
Polycystic ovarian syndrome we commonly call as PCOS. It's a condition characterized by menstrual irregularity, features of hyperandrogenism like acne, hirsutism, alopecia, obesity, and ultrasound finding of polycystic ovaries. So, it can commonly say it as a hormonal imbalance, or you can say it as a most common endocrinological and metabolical disorder seen in women of reproductive age group.
Okay.
So, it can affect women of any age group. Most commonly seen in women of reproductive age group, but seen in adolescents to perimenopausal age group.
Okay. So, Doctor, we would like to know more about the symptoms of this condition.
So, most commonly for a person, I will tell you that when you are having two or more of these symptoms, what I am going to discuss, you should arouse suspicion of PCOS.
Okay.
That is when you are having irregular cycles. We are not getting skipping the periods by 1 month or more, or you are having delayed periods, we call it as menstrual irregularity. So, when you are having menstrual irregularity, you should arouse suspicion of PCOS. Another thing is that you are having hair fall or thinning of hair. It starts as diffuse alopecia, then you go to male pattern of baldness or receding of hairline. Then the other thing is that you are putting on weight in spite of no change in lifestyle, or you have difficulty in losing weight in spite of trying. The other thing is that facial hair, we call this a hirsutism. Excessive male pattern of hair in the upper lip, jaw, chin, body, all over the body, it's called hirsutism. These features, any of these are there, you have to arouse suspicion of PCOS.
Okay.
Another thing is that sometimes we notice that discoloration of the neck, blackish or brownish discoloration of the neck, chest, lower back, etc.
So, these are the symptoms of
These are the symptoms.
Usually found symptoms.
Yeah, so when clinical features if you are asking, I'll tell you menstrual irregularity, that is irregular menstrual cycle or amenorrhea, that is the most common finding. Then obesity, infertility, features of hyperandrogenism, acne, hirsutism, alopecia, or sometimes the patient may elder age group, they come with diabetes, hypertension, lipid problems like dyslipidemia, we commonly say like that.
Okay.
These are the clinical features of PCOS, but when you are having two or more of these symptoms, you definitely have to have a checkup.
Okay. So, who are all prone to PCOS, or around what group you find usually?
See, PCOS can occur in any age group, but most commonly we are seeing cases in women of reproductive age group. Adolescents are also prone to this PCOS. Nowadays, during the last few decades, we have seen increase in the number of PCOS among adolescents as well. So, the overall prevalence we can say it as 6 to 10% globally. About 50% of the women with infertility will have PCOS.
Okay. How would I know that I have PCOS? When should I visit a doctor?
So, I told you, the clinical features, when you are skipping a periods or you are having irregular periods like missing a period, or irregular, consistently you are not getting periods, like that it's one condition. Then excessive hair fall, thinning of hair or excessive hair fall, acne, hirsutism, which are not responding to the regular treatment, you should definitely go to the clinician. Or if you are putting on weight, excessive weight gain, two or more these features if you have, you definitely have to go for a checkup.
Okay. Then we have to go for the clinical checkup.
But most commonly, people will come during that infertility time when they are getting married. After marriage, when they are not conceiving, when they are having a problem, that time only most of the people come for a checkup.
Okay.
So that time it will be late.
Yeah. So, doctor, what are the causes? Can you mention the causes of PCOS for us?
The causes of PCOS is multifactorial. Most commonly, it is a genetic link.
Okay.
So, if a woman is having PCOS, it's more likely that another woman of the family, either from the father's side or mother's side, will definitely be having this complication, this PCOS. Then environmental factors, lifestyle modification also add to this. So, the inheritance, we can say it as it's a complex inheritance.
There's a main cause of any other causes for PCOS?
This lifestyle is changes are very much significant in a person is having genetic code of PCOS. That is, if they are into the habit of eating junk foods, putting on weight, without any regular exercise, they are adding on weight, becoming obese. So that genomic coding, it becomes more activated. So the lifestyle is very important in a person with PCOS.
Okay. Now you mentioned about the overweight. Any connection between obesity and PCOS?
See, the most common clinical feature is obesity. But it's not that only obese patients will have PCOS.
Yeah.
Even 5% of the lean persons can have PCOS. And around 20 to 30% of the persons with normal weight or underweight can also have PCOS. So there is not such a thing that lean persons can't have PCOS, but mostly seen in obese patients.
Okay. So if you find the symptoms, how can we diagnose it as PCOS? What are the tests to be done to diagnose PCOS?
By clinical manifestation itself, we can diagnose PCOS to a certain extent. That is, suppose if a woman is walking in with obese woman walking into your room with she is complaining of irregular cycles, and on exam and seeing her, we are finding acne, hirsutism, etc. Then we can clinically itself diagnose PCOS. It's not that you should have an ultrasound finding for diagnosing PCOS. So we have got a definite criteria for this diagnosis of PCOS. We call it as Rotterdam criteria. Most commonly accepted criteria is Rotterdam criteria. Any two of the three symptoms should be there for the diagnosis. So the criteria says you should have either oligo-ovulation or anovulation. Then features of hyperandrogenism, that is acne, hirsutism, alopecia. This could be diagnosed either clinically or biochemically by a lab test. Then is the ultrasound finding. Ultrasound showing polycystic ovary. Any two of the three is only needed. So it is not that you have an ultrasound finding of polycystic ovaries that you are diagnosed as PCOS. Not like that. Two criteria should be there. So coming to oligo-ovulation, there is a confusion that people with regular cycles can have ovulation. Irregular cycles can only have an ovulation. It's not like that. People with regular cycles also have an ovulation. So the definite diagnosis for oligo-ovulation is by testing progesterone. Progesterone on day 21 will give a definite diagnosis that you are ovulating or not. This is mostly significant in the case of infertility cases. The other thing is lab tests we used to do, that hormone profile we used to do. That is the most commonly tested are FSH, follicle stimulating hormone, and LH. Then other hormones like prolactin, thyroid, these are to rule out other causes of menstrual irregularity. Then in testosterone also will do, because she will be having this androgen excess, So free testosterone, total testosterone also we will do. Then elder age group, they will be having pressure, sugar, like that problem. So glucose tests, these people with PCOS, they are more prone to have glucose intolerance. So we usually do the fasting blood sugar and 75 gram glucose test and 2-hour sampling. Then the other thing is fasting insulin. Then the last we usually do the cholesterol profile, that is called as lipid profile. These are the common tests we have to do in a person suspecting PCOS. Then some people usually ask, why doctor you are doing thyroid and prolactin? So this thyroid and prolactin also are hormones. They have to be tested to rule out the causes of menstrual irregularity.
Okay. Now about the symptoms you told, then you mentioned about the acne. What type of acne do you find during the PCOS?
Yeah, that's a good question. So see, normally all acne or breakouts can't be due to PCOS. The cases mostly seen will be cystic or large acne. Then this acne will be coming in clusters. They are not responding to the usual remedies, that leading to scarring. This is the type of acne we've seen in PCOS.
Okay. Doctor, what are the complications associated with PCOS? That's a main topic we want to discuss.
Yeah, there's always a doubt whether we should treat PCOS or not. The answer to this question is definitely we have to treat PCOS, because PCOS is a condition which can lead to long-term sequelae or complications, that we call it as metabolic syndrome, that is obesity leading to glucose intolerance or diabetes, hypertension, cardiovascular abnormalities, then infertility. Then these are the main complications. We call it as metabolic syndrome. See, if untreated, it can lead to infertility problems as well. Then during pregnancy also, these patients can have problems like miscarriage, gestational diabetes, mood disorders, anxiety. So definitely the answer to this question is PCOS has to be treated.
Doctor, I would like to know more about the menstrual irregularities associated with PCOS.
Yeah. So I have been telling menstrual irregularity in PCOS, right? So we have got a criteria for considering irregular cycles, irregularity in periods. That is, up to 1 year of attaining periods or puberty, any abnormality is considered normal.
Okay.
So after 1 year to 3 years, cycle length less than 21 days or more than 45 days is considered abnormal. More than 3 years of attaining periods to perimenopausal age group, cycle length less than 21 days or more than 35 days is considered abnormal. So it will be around less than 8 cycles per year. This is the commonest thing we see as irregular periods, irregular cycles.
Okay. So once a woman is diagnosed with PCOS, what are the treatment options you prefer?
Yeah. Interesting. That we categorize the patient into what sort of treatment we have to give. Suppose if an married woman without children, she is planning pregnancy, the treatment is to make her pregnant, no? So we give ovulation inducing drugs, because these patients will be having oligo-ovulation or anovulation. So we will be giving ovulation inducing drugs and fertility treatment. Suppose a person is coming with already completed family and her problem is only menstrual irregularity, we will be putting on her birth control pills to get the periods regularized.
Okay.
So that she gets a regular cycle. Suppose if it is an adolescent girl and her problem is acne, hirsutism, this androgen excess problem, we'll put on a definite birth control pill which attends to this sort of problem. So we categorize and then only treat the condition. Suppose already completed families, a little bit on the elderly woman, they will be reluctant to take this birth control pill. For them, we advise at least withdrawal bleeding with progesterone. We give last 10 days of the periods, we give progesterone and get them withdrawal bleeding. So we've left untreated, no, this unopposed estrogen, they are not ovulating, no, so only the estrogen hormone is there, no progesterone. So unopposed estrogen can lead to cancer. The most common is uterine cancer and breast cancer. Okay. These are the other causes, late time complications of PCOS.
Okay. So doctor, how does PCOS cause infertility in women?
See, people come with infertility problem. Most common people coming with infertility problem will be having irregular cycles. These irregular cycles will lead to will be the cause of anovulation. So if only ovulation is happening, there is chance of getting pregnant. So that is the main cause of infertility.
Okay. So any lifestyle modifications we can go for to control PCOS?
Yeah. Medicine plays its role, but the most important or key factor is lifestyle modification. We have to take a balanced diet, not fasting or like that. We have a proper balanced diet should be taken and should be consistent in that. Okay. Then exercise is also very important. Diet in the sense low carbs, high protein, low fat diet with lots of vegetables and fruits should be included. Then small frequent meals will be helping. Then exercise also, at least 30 minutes regular exercise is very much needed. Then avoid junk foods and all.
So doctor, please explain the lifestyle modifications we can go for to control this PCOS.
Lifestyle modification is a very important part of PCOS. So we have to take a regular and balanced diet. The diet low in carbs, high protein, low fat, vitamins, minerals should be added. And it's not that you should skip a meal. Take small frequent meals, that is more enough. Then exercise. Daily exercise or consistently doing exercise is very important. It could be either a walk for 30 minutes or Zumba or anything you can do. Whatever you like you can do, but it should be consistent. Then we have to avoid stress and get a good sleep.
Okay.
And mental health is also very important.
Okay. So doctor, you explained everything in a detailed manner. Thank you very much. And any advice from your side for our viewers on a healthy lifestyle to control PCOS?
So my advice is that lifestyle modification is very important in the case of PCOS. So obesity is the most common clinical condition. So obesity has to be kept under control. That is by a proper lifestyle. Diet is a very important part. You should avoid junk foods. Then diet low in carbs, high protein, low fat, essential vitamins and minerals should be included. Along with that, you have to take moderate exercise. Exercise at least for 30 minutes, walking or any type of exercise like Zumba, dance, whatever you feel like you can do the exercise, but make sure that you are consistent in that, diet as well as exercise. Because obesity, if you are controlling obesity, to an extent you can keep PCOS under control. So my advice to viewers is that if you are having any problem like menstrual irregularity, acne, hirsutism, alopecia or overweight or obesity, it should be suspicious of PCOS, and make sure that you get a checkup to assess whether you are having this condition, and that if you are having an ultrasound finding of PCOS alone, it's not diagnosis of PCOS. You may not be having PCOS because you should have the other factors also.
Okay, thank you, doctor. Thank you for being with us and giving us a lot of valuable information about PCOS.
Accept. It is my pleasure to have a talk with you.
Thank you once
Nice to
again.
see you.
So viewers, I hope this was an informative episode. As doctor said, if you find any symptoms of PCOS, don't panic. Go for a clinical examination and take care of yourself. Be happy, be healthy. This is Jessila Mujib signing off. Good night.